I'm Dr. Ron Torrance, and I specialize in sports medicine at the Regenexx Orthopedic Office of Florida, a Regenexx affiliate. I've been an athlete since I could remember, and my parents actually made a big sacrifice when I was 12 to move down to Florida so that we could play sports year-round. And since that time, I've always been athletic, I've always been doing sports. I'm always trying to figure out how to get back to activity if I ever had any issues. And that's something that I instill in my patients. I want them to get back to doing what they love doing in the fastest way possible and the most responsible way possible. I became interested in regenerative medicine because I believe that the body will heal itself if put in the right atmosphere or right environment. Regenerative medicine is really cutting edge. It's the next wave of things that are going on in the orthopedic world. I believe this will almost replace most of the orthopedic procedures that are going on right now, such as knee replacements, hip replacements, and if we can get to these patients earlier, I believe that they'll have more benefit in the long run. Traditional orthopedics procedures have a shelf life of about 20 years. And when a 40-year-old recommended a knee replacement or hip replacement, that 20 years requires them to get a second procedure. So this is where regenerative medicine is going to fill the gap. There's an opportunity to minimize the need for knee replacement, hip replacement, and shoulder replacement with regenerative medicine. We at Regenexx Orthopedics of Florida use precision guidance, ultrasound and fluoroscopic live x-ray that puts cells in the exact location of injury to more precisely target an injury. Our expert lab technicians manually separate PRP and stem cells, count the number of stem cells that are live and the total number of stem cells, and that is directly influenced by your nutrition, your exercise, and your sleep. Becoming a Regenexx provider allows us to use our experiences as clinicians to help better our patient outcomes.